Derita, derita, derita. Stop, stop, stop. Okay, okay. Hop, 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 hop. No le mueva. Asparagus.
Hey guys, what's up? It's Stephanie and welcome back to my channel. So in the video today, I'm going to be discussing healthcare experience hours. So what are healthcare experience hours? So for those of you who are interested in applying to PA school or are in the process to applying to PA school or are pre-PA students, you know, most PA programs do require healthcare experience hours and patient care experience hours, shadowing, and volunteering sometimes is not necessary, but it does make you a better applicant if you have volunteering hours. So what are healthcare experience hours? So I'll be discussing that, and then on top of that, I'm going to be discussing what was my healthcare experience hours, how did I get those healthcare experience hours, etc. So healthcare experience hours are just hours that you spend either working or whether it's volunteering in a clinical setting. So whether it's in a hospital, whether it's in a clinic, whether it's in a freestanding ER, etc. It's just any area that's healthcare related that you are either working or volunteering. Now, the difference between healthcare experience hours and patient care experience hours is that in patient care experience hours, you're actively working with patients. So you are either, for example, doing injections, putting IVs in, you're actively working and touching patients in comparison to healthcare experience hours where you work with patients or you are around patients, but you're not actively working on them. So you're not actively putting IVs, putting injections, etc. So you're not actively working on them. So for example, some examples of patient care experience hours are pharmacy technicians. Another example is just an emergency room technician, medical assistant, nurses, etc. So just something that you're working with patients. I know some of my classmates were dietitians, so they were working with patients hands-on, and also some of my classmates were also EMT, so they worked on ambulances, so they were actively working with patients also. Some of them were occupational therapists, physical therapists, respiratory therapists, and once again, they were actively working with patients. In my experience for patient care experience was medical assistant. I only had about a year for medical assistance, but I was actively working with patients. I was triaging them, taking their blood pressure, taking their vitals, giving them injections, doing ear lavages, etc. Once again, working with patients. Now, healthcare experience is when you're not doing any of that. So you are just working in a clinical setting. My healthcare experience was, I worked at a hospital as a registrar. So what is a registrar? A registrar is an individual who goes to the patients and works more on the financial side. So I'm responsible for getting the demographics, which is their address information, their insurance information, and collecting their co-payments. So I worked alongside doctors and nurses and technicians, medical assistants, etc. But I did not work on patients. I did talk to a lot of patients and I mingled with them, but I wasn't directly working with them. So that was a difference. I did this from 2012 to around 2017. So I had about 5 years of experience of doing this. So I was able to rack about 14,000 hours during that time, and those 14,000 hours went on my application for healthcare experience hours. I worked in a variety of healthcare settings. I worked in the emergency room, in multiple emergency rooms, in psychiatry. I worked in surgery. I worked in labor and delivery, etc. So I worked in a lot of areas, and I was able to put this on my application. So healthcare experience, once again, is that you are working in an area, whether it is as a registrar like I did, whether it is as a front desk, which is just checking in patients, whether it is doing paperwork or volunteering even, transporting patients up to floors or transporting patients to their rooms, etc. It's just you in a healthcare field where you're not directly working on patients. So most of the PA programs require a certain amount of healthcare experience hours, and these hours tend to vary on the program that you apply to. I know I think my program was 1,000 hours, so it really depends on the program. Some programs that I applied to didn't require as much, some of them required more, but it really changes on the program that you apply to. So that's for healthcare experience hours. So if you're interested in getting healthcare experience hours, I would really recommend, if you can, try to get a job in a clinical setting, whether it's in a hospital. I know also another thing that's very, very debatable is also scribes for doctors. I know certain schools that I applied to took those hours as patient care experience hours, but then some schools specifically said that scribe hours were healthcare experience hours and not patient care experience hours. So that's why, once again, it's really important that you research the schools that you apply to see whether, if you're working as a scribe, whether that's going to count as patient care experience hours or healthcare experience hours. So that's why it's really, really important that you do that before you apply to PA school. So once again, you can also become a scribe. Usually with scribes, they don't require any experience whatsoever, just that you're interested in the medical field, whether it's nursing, becoming a doctor, becoming a physician assistant, nurse practitioner, etc. That you're interested in that field. I know some of the jobs here in Texas, though, I don't know in other states, for scribes, they don't get paid as well. Hence why I didn't go the scribe pathway. I decided to go the registrar pathway because I got paid a lot more than they did. I think here in Texas it was around $9 per hour, $8 per hour. Now this is just in Texas, in the area that I lived. It might be different in other states, but it was very low in comparison to what I was making, which was like around 14 or 13. So a huge comparison. So that's why I decided to go the registrar. And then on top of that, my hours are very convenient for me. So I really, really like that. And then on top of that, most of the scribes, if you do want to become a scribe, I worked alongside a lot of scribes, is that you're also able to make your schedule, which is pretty awesome because they do know that you're students. Some of them worked overnight, weekends, just like I did in my registrar job. That way they could attend school during the week. So it's a good job to get your, whether it's healthcare experience or patient care experience hours. Good job to be able to work with doctors and physician assistants just in case you need that letter recommendation. So I really, really recommend for those of you who are interested in pursuing PA career, to do scribe. I really, really recommend it. Or even a registrar, which I did. It's just that for registrars, for sure, those are healthcare experience hours, not patient care experience hours. And like I said, some schools will take your scribe hours as patient care experience hours, but you have to research them before you apply and you put those hours towards that. So scribes, definitely. You can also do be a registrar. Also, if you just volunteer and you're checking in patients or you're transporting them, like I said, you can count those as patient care experience hours or healthcare experience hours. Whether you're working billing or coding, you can put those as healthcare experience hours also. So just working in the healthcare fields alongside physicians and nurses and practitioners, and working alongside patients or with patients, you can put that as healthcare experience hours. For those of you who are in college and want a job that pays well, that you're able to get all this experience, you can do the registrar way, which I did. And like I said, registrars usually do not require any experience. You can actually just Google registrar and they'll hire you, they'll pay for your training. In my experience, they paid for my training. They pay very well also. Or you can do the scribe also. The thing with registrars, you're not working as close with doctors as scribes are. Scribes is like you're literally working next to a doctor. You're scribing whatever the doctor says. You have that strong relationship with the doctor or the practitioner that you're working with. So that's really good in helping you get a strong letter of recommendation, which is needed for PA school. So it just really recommends. You can also be, like I said, a coder, front desk office in urgent care clinics, or just a doctor's office checking in patients with your healthcare experience hours. And the good thing about usually if you do work in a front desk, because I did that also, I worked for an urgent care, is that sometimes they'll cross train you and you can actually use those hours for your patient care experience hours, which which are required for PA school. So I really recommend this. Also, is that if you are interested in PA school and you don't want to go to school for medical assistant, which is usually like 6 months, and on top of that it's crazy expensive, then you can try to get a job as a front desk, and whether it's a doctor's office or whether it's an urgent care, just tell them you're interested in becoming a physician assistant or a practitioner, or whether you want to attend a medical school or etc. And usually the doctors are very receptive, or even the medical assistants are very receptive, because you'll be able to help them out whenever they're busy. So they'll train you how to do back office stuff or how to do medical assistant stuff, and you'll be able to apply all these hours to your application for PA school. And I know most of my classmates have done this. One of my classmates, which is the youngest one in my program, which I've made a video about, she actually did this. She worked as a front desk and she was cross-trained as a medical assistant, and that's where she got all her healthcare experience hours and her patient care experience hours. So definitely recommend that, guys. Alright guys, so I hope this video was helpful for you guys. For those of you who are interested in becoming physician assistants and aren't sure what healthcare experience hours are in comparison to patient care experience hours are. So once again, patient care experience hours is when you're actively working on the patient, whether it's, once again, placing IVs, giving them injections, placing casts, etc. And examples of these are nurses, technicians, emergency room technicians, pharmacy technicians also, occupational therapists, respiratory therapists, physical therapists, etc. Versus healthcare experience, you're not actively working with the patient. You are more kind of working with patients but not actively on with them. So this is, for example, your coders, your front desks, your registrars, which is what I did. Scribe kind of goes in between, just depending at what school you're applying to, whether they take it as patient care experience hours or healthcare experience hours. So research your school. Alright guys, so I hope this video was helpful for you guys. If you guys have any questions for me or any comments, make sure you comment below, and I will talk to you guys later.